security from my organization is I have 700 social workers. I have people that stand up in the middle of orientation and tell me, yeah, I got into social working, so I didn't have to use a computer. And I'm telling them that they have to use the computer. So it's a little challenging there. Any of you guys probably in all healthcare sectors, but certainly in behavioral health, dealing with psychiatrists, doctors aren't leading edge technologists, right? I had one doctor that put in a workers' comp suit for metatarsal or work, his wrist, he couldn't type on a computer, like, okay, or use a mouse. So, they're challenging to ensure that they're always going to type encrypt into the subject line before they hit send, or they do some other things, right? So these are challenges that were posed. Are they going to constantly be mindful of all of the HIPAA requirements? Don't print that form out and put it in your trunk when you leave. Don't do those things. It's been a challenge for me to dealing with folks that are anti-technology, right? They're not wanting to learn. I don't want to learn a computer. And I've heard that too many times. We also, as a not-for-profit, it's tough with just limited funding. I put on here, I talked to the CFO before, and she said it's about a 10% is what we generally get and for administrative functions. And I started just thinking about the IT spend that comes out of 10% of a contract. And this isn't even counting the AP department, the payroll department, HR, billing, and all the other administrative functions we have. But these are, again, some of the challenges. Then how do I keep Henderson Behavioral Health locked and loaded, prepared from a security standpoint when I've got users that aren't really caring about that? They just want to be good caseworkers or case managers or therapists, clinicians. They're not thinking about security all the time, right? They're trying to help people, not think about the computer. We have to then fund, anybody looked at what a SOC costs for 24-hour monitoring and response? It's a little pricey, and so those are some of the challenges that I face down here. I'm not sure if you guys have any of those funding challenges, or if you've come in any unique ways of getting around it. Hawala mentioned the fundraiser. Our gala is our annual largest fundraiser, so we try to do things like that. I think that's pretty standard.